Maybe
This is
two
my
for there.
audience for today. Okay. All right, we ready? Okay. Hello, everyone. I'd like to thank you for listening to my speech talking about the residency shortage in the United States. And we'll go ahead and get started. And I would like to start by asking you to picture a situation. Imagine that you are sitting in your bed one day and you just woke up and you have a sore throat. And turns out you have a fever and you start coughing midway through the day. And come to find out, you're getting symptoms of the cold or COVID or the stomach virus, and you need to go to the doctor to be evaluated. However, you get there and they say that there is a 2-hour wait in order to speak with a physician, or that you're gonna have to end up traveling clinics. Sometimes, in some cases, up to about 5 hours from certain anecdotes from people online. This is a very common situation in which people face in our community, where there are not enough doctors in order to see everybody. There are long wait times in order to get in with specialty physicians, and that has affected our communities more and more over the past several years. So, everyone in the news talks about the various medical advancements we've made over the years. However, we can't implement these advancements without doctors in our communities to practice them. So I would like to start also with a statistic from the Tennessee Hospital Association published in 2026 that says that we are short about 18,800 doctors currently in the state of Tennessee. We are 13% below the average per capita for physician to patient ratios. And this number will continue to be exacerbated with another shortage of about 3,900 by 2035. So this issue is very relevant to me. It hits close to home as I'm planning on becoming a physician in the future. I have worked with patients in the hospital who have had limited access to doctors and other practitioners along the way, and it has affected them systemically throughout their whole life and affected their care and their care outcomes. So I would also like to encourage you guys today to contact your congressman in order for them to support the House Resolution 4731, also called the Residency Shortage Reduction Act of 2025. So we have this shortage of doctors that stems from a bottleneck in residency positions that are funded by the government, which then leads to a shortage of doctors in our communities, which then leads to poor health outcomes for individuals in our communities. So first, a graduate, upon completing medical school, receives their medical doctor or their doctor of osteopathic medicine degree from their medical school. However, they are not able to practice medicine directly after that. You can think of it as a pilot that has graduated training, but they don't have actual flying hours yet, so they are unable to obtain their license. They have to have on-the-job training and exposure to, flight paths and maneuvers in order for them to be able to become a practicing pilot. And there's a very similar comparison to that with doctors. They have to have on-the-job training and exposure to patients before they are able to practice as an attending physician. So, as I mentioned, the government funds these residency positions that are offered upon completing your medical degree. And part of it is funded from the government through Medicare, and the other part is funded from the hospitals themselves, from insurance money. And so currently, the amount that is appropriated to hospitals for these residency programs is based off of the number of residents entering the hospital systems in the fiscal year 1996. This number has not been updated since, and with the growing number of patients needing medical care in the United States, this number has lagged behind by about 30 years or so. So that is the main issue driving the residency shortage today. For example, the Government Accountability Office stated in 2021 that 70% of hospitals are having to operate above their federally mandated cap for the amount of residents that they are training, simply due to the fact that there's not enough federal funding for them, and they're having to use their own profit margins in order to fund those positions. And currently, nationwide, we are predicting a shortage of about 86,000 physicians due to this residency bottleneck by the year 2036, with rural hospitals being affected up to 60% of all the hospitals being affected by this, compared to 10% in rural areas. So there's definitely a difference between rural and urban when it comes to the amount that they are affected. So this physician shortage leads to patients having to have longer wait times in the ER. It's leading to healthcare workers in the ER being overworked and unable to completely care for their patients one-on-one. And it is causing increased financial pressure on hospitals in order to cut costs and reduce staffing numbers in order to maintain their profits. So the needs of today for patients needing physicians is based off of a number from 1996, and this issue needs to change currently. So the solution to this problem, as I previously mentioned, is the House Resolution 4731. It plans to add 2,000 residency positions per year for 7 years, totaling up to about 14,000 residency positions, with a focus in rural and healthcare shortage areas being higher priority for these residency positions. Another priority for the hospitals receiving these positions are the 1/3 of hospitals currently that are operating over their federally mandated residency cap. And this bill also serves to allow physicians to continue practicing in their areas upon completing their training. The American Association of Medical Colleges in 2025 stated that 55.7% of physicians that complete a residency training stay in state as an attending physician after they complete their training. And this leads to physicians being in the system longer and providing care over time. So a common counter argument to this bill is that the last 1,000 positions that were added as a federal mandate costed about $1.8 billion. However, over time, this serves to ultimately give money back to the hospitals, as physicians are a main driving source of revenue for these hospitals, ultimately leading to a good investment for the federal government. The Journal of the American Colleges stated in 2023 that 88% of residency programs do not currently have a rural focus in their training. And this bill would lead to curb that by placing an emphasis on residency positions in rural areas or areas that are affected by shortages. So they would also track over time where these residents are planning to practice after they are attending physicians, and would affect the future distribution of these attending physicians. So today I ask you to contact your local House representative and the 2 state senators to urge their support for the House Resolution 4731 to protect rural residency positions and lead to greater health outcomes in our areas. We are not just bystanders in the situations, we are patients and taxpayers directly contributing to this issue and helping solve it. We have graduates ready to practice, we have hospitals ready to employ physicians, and we also have a community that is depending on our actions. So today I ask you to join the commitment to help serve our communities. Thank you.
It's good, very informative.
Good, man.